It's important that your child, your teen, gets the right amount of sleep every day. Children and adolescents who do not get the right amount of sleep are at risk for health and behavioral problems. In this video, we will talk about the importance of sleep. Are students getting the right amount of sleep? Why is your teen not getting enough sleep? And what are some ways that we can do to have our children get more sleep? Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Lack of sleep in children and adolescents. Sleep is important. Children and adolescents who do not get the right amount of sleep are at risk for obesity, diabetes, injuries, poor mental health, and problems with attention and behavior. How much sleep a child needs depends on his or her age. According to the American Academy of Sleep Medicine, children aged 6 to 12 years need 9 to 12 hours of sleep every day, while teens 13 to 18 years of age need 8 to 10 hours of sleep every day. The American Academy of Pediatrics also endorses these recommendations. However, in a 2018 study, it reveals that 78% of high school students fail to reach this mark. So, are students getting enough sleep? No. According to the CDC, or Centers for Disease Control, most middle and high school students are not getting enough sleep. In fact, more than 2 out of 3 high school students are not getting enough sleep. And a similar trend is found in middle school aged children. This was discovered in a youth risk behavioral survey done in 2015, administered to high school students from 30 states in the US. So why do teens lack sleep? There might be several reasons for this. During the teen years, the circadian rhythm, or the body's internal clock, is reset, whereby teens tend to fall asleep much later and wake up later. This might be due to the brain hormone melatonin, which is released later at night, which makes it hard for the teen to fall asleep early. The changes in the circadian rhythm coincide with the busy time in their lives as well, wherein the pressure with school is much more intense, wherein it is harder to get by without studying hard, and also teens are faced with sports and other extracurricular activities, and also working part-time jobs. Many teens also stay up late at night texting their friends, playing games, and watching videos. Another reason might be the early school start time, wherein if the teen falls asleep after midnight and has to wake up early for school the next day, well, the teen would just have to squeeze in 6 or 7 hours of sleep. Although a few hours of sleep might not be a big deal, over time this would cause a noticeable sleep deficit. So, sleep is important for your child so your child can be at his or her best, to pay attention and learn better in school, to have improved athletic performance, to grow and develop normally, and to be healthy. The consequences of lack of sleep are poor grades, relationship problems, drowsy driving, and health problems such as heart disease, obesity, diabetes, and emotional problems like depression. So how to tell if your child is getting enough sleep, and what are some of the ways that you can do to have your child get more sleep? But before we go to that, are you expecting a baby? How much better life can be when things are under your control upon baby's arrival, where you know and feel confident about breastfeeding, when you know how to deal with a crying, fuzzy baby, when you know how to soothe baby, and you know when to worry and call the doctor. When you feel well rested and take care of yourself as well, because you can understand your baby's sleep schedule. How much better life can be when you can get this at the comfort of your own home. Well, I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. Now, how can you tell if your child is not getting enough sleep? Well, some of the signs include if your child has a hard time waking up in the morning, if your child has trouble concentrating, if your child falls asleep during classes, and if your child seems to be irritable, moody, sad, or depressed. Now, what are some of the ways that you can do to have your child get more sleep? First, set a regular bedtime and a regular wake-up time. And remember to stick to that schedule. Keep it 1 to 2 hours within that time frame, even on the weekends. Next, exercise regularly. This can help your child sleep better. Although, do not exercise before bed because it can rev the body up and make it harder to fall asleep. Third, avoid caffeine. Avoid beverages containing caffeine after dinner, and this includes sodas, teas, and coffee. Also, nicotine from smoking and vaping can make your child restless and interrupt sleep. Fourth, unwind using low lights at night. The light signals your brain that it's time to wake up. So stay away from bright lights such as screen devices. And also you try listening to music and meditating instead at night. Next, turn off electronics. Don't let your child use the phone, not even texting, the tablet, computer, or television an hour before bedtime. Also, don't nap too much. Naps more than 30 minutes during the day is not helpful, and don't nap close to bedtime as well. This makes it harder for your child to fall asleep at night. Then, create the right sleep environment. Children sleep best in a dark room with a cool environment. You can use nature sounds or a white noise machine if you're trying to block away a noisy environment. Hey, if you liked this video, watch my next video where I teach you about other child health problems.